Good afternoon. My name is Robert Granger, and I'm the president of Nautical Health. And thank you for joining us for our second iteration of U.S. Health Best Practices for MENA Transformation. Today, we're going to focus specifically on health governance. So, to tell you just a little bit about myself before we jump into the presentation for today, I am the president of Nautical Health, and I have a background primarily in public health as well as healthcare reform in the United States. I advise health plans, hospital systems, as well as government agencies in the areas of population health, healthcare transformation, care management, and technology adoption. My goal is to bridge the strategy and the operational execution, as well as I'm committed to making sure that individuals in the MENA region have the opportunity to learn as well as emerge some of the best practices from the United States. So today we're going to kick off by simply defining what health governance is. Uh, but for any means necessary, health governance can be described as any rules, policies, or directions specifically for healthcare. And when we're talking about health governance in particular, some of the things that come up includes what decisions are made and how they're made, um, looking at things such as quality, safety, as well as accountability, as well as connecting government, providers, and patients so everybody's on the same page. In the United States, there are four major health laws that help to shape governance in terms of our healthcare system. The first one, which was the first major bill for healthcare, was the Children's Health Insurance Program, also known as CHIP, and this expanded healthcare coverage specifically for children. So, under this particular bill, all children in the United States, whether your parents are working or not, are eligible for some form of health care. In general, if your parents are not working, children enroll in a form of Medicaid that is generally implemented by each state. The next is the Health Insurance Portability and Accountability Act. This is HIPAA, and basically, this is our bill that protects patient privacy as well as making sure that you have access to your personal health data. Next is the Affordable Care Act. This particular bill expands the access to health insurance coverage as well as laying the groundwork for healthcare transformation. And then finally, the final bill is the Health Information Technology, Economic, and Clinical Health Act. I know that's long. It stands for high tech. And this is the bill that creates infrastructure around the use of electronic health records. As we continue on in the conversation, one of the things that I think is very unique about healthcare in the United States is that inside of the US Congress as well in state houses, we have the ability to have lobbyists. So lobbyists work in various personal interests of corporations, of hospitals, as well as nonprofit organizations. And so with the lobbyists, they go to Capitol Hill and try to persuade the directions of how a law is developed, as well as what the law impacts, when the laws start, and what type of information is actually written into the law. So it's important for us to talk about lobbying as it relates to healthcare governance because it is a bit controversial. For example, pharmaceutical industries will lobby to keep the price of prescriptions the same price that they are, while there are other lobbying groups that are trying to lobby to cap the prices of particular drugs. So to move on further, I wanted to take the opportunity to talk about federal oversight and what that looks like and why it's important in terms of our healthcare governance inside of the United States. To get started, a couple of things come to mind. The first being that we have a unique system that starts with the White House. The White House sets the agenda for healthcare for that particular administration. So currently under President Trump, he will set his agenda, and then that agenda makes its way down to the United States Congress, and in the United States Congress, they pass budgets, they modify healthcare bills, they develop new health care legislation as well. And then from there, it moves into the U.S. Department of Health and Human Services. And in general, this is the big umbrella of federal health care. This is where the budgets are implemented, programs are implemented, as well as you make sure that all of the resources are adequately distributed from the federal government going down into the United States healthcare system. On the right of the screen, you have the three major federal government agencies that play a major role in healthcare implementation. The first is the Center for Disease Control, which is by far the most popular. This is the organization that is responsible for research, healthcare communications, as well as any recommendations for any major healthcare concerns. Next, you have the Centers for Medicare and Medicaid Services. This is the organization that supports payment, reimbursement, as well as setting the insurance standards for the United States. And then finally, you have the Health Resources and Services Administration. Now, the Health Resources and Services Administration is very similar to the structure of Saudi Arabia, in the likeness of the healthcare clusters that are set up. This is where the money for the actual implementation of healthcare systems, including community health centers and various primary care clinics, gets rolled into the U.S. healthcare system. Next, I wanted to be able to show you the U.S. healthcare system from the very vast way that it's organized currently. So at the top, you have the U.S. Department of Health and Human Services, which includes the CDC, HRSA, and CMS. Right under it will be the health insurance companies. Under that will be all of the generic entities that make up our U.S. healthcare system. In particular, the primary care groups sit in the center, followed by hospitals, behavioral health, your allied health centers, which are things like physical therapists, your pharmaceutical companies that produce the drugs, specialty care groups like endocrinologists and cardiologists, and then your pharmacies. Now, when we're talking about healthcare governance in modern terms, there are a couple of topics that are most important for compliance, implementation, and all things healthcare for the common American person. The first one is access to primary care. As I said on the previous screen, the primary care organizations stand as the nucleus or the center of healthcare. This has been one of the most important tools to make sure that healthcare costs is reduced, as well as making sure that all patients had at least one person to represent them medically. Next is patient safety, patient experience, insurance fraud, and prescription drugs costs, which we'll go into greater detail shortly. So first, we want to talk about the emphasis on primary care. So inside of the United States, it's really important to note that primary care is the main entry point for our healthcare system. So although a person can go to an ER, they can go to a hospital, it is really recommended that you first have a primary care doctor. This primary care doctor in the United States is important for prevention, for diagnosis, as well as for the management of chronic diseases. These individuals are also responsible for the coordination of all of the care, making sure that there's accountability as well as having continuity in these services. So, for example, the primary care doctor in the United States will implement the referral for the endocrinologist if a patient needs to see one, but they would also be responsible for making sure that these endocrinologist notes are brought back and then delivered to the patient to resume their care. It is also the responsibility of primary care physicians to reduce the unnecessary hospital visits as well as overall costs. And primary care agencies are also responsible for promoting health equity, gaining community trust, as well as improving that access to better care. Next, I wanted to have an opportunity to talk a lot about patient safety. Patient safety in general is really important for making sure that we prevent medical errors, infections, and any other thing that can cause harm to a patient. In the earlier stages of looking at patient safety, most of these things were done in documentation and medical charts. Now, through modern technology, we're able to transpose these standards into reporting systems and other ways to implement oversight. One of the things that's really important in patient safety, it really starts with communication between the providers, the staff, and the patients, as it's important to remember that hospitals and clinics all develop their own structure for monitoring patient outcomes, as well as correcting any type of risk that needs to be mitigated. And finally, it's important to make sure that we assume any type of cultural norms when we're holding people accountable, we're training patients, as well as we're making any strides for continuous quality improvement. The patient experience is really important to ensure that patients, A, stay under the care of their primary care doctors, as well as making sure that they get the most out of their healthcare experience. So, under this particular issue in the United States, there's a couple things that I wanted to make sure that we make very clear. Number one, communicating with the patients, wait times, responsiveness, and the ease of access is really important to make sure that patients have that grand experience from the moment that they walk through the doors of either a hospital or a primary care group. It's also where you establish trust and make sure that the patients are willing to return for care. This is also where you address care gaps and make sure that you have the opportunity to improve their satisfaction, engagement, as well as patient outcomes for year to come. In the United States, there's an organization known as Press Ganey. Press Ganey is responsible for evaluating patient experience on a regular basis. Hospital groups can actually pay Press Ganey to administer surveys to the patient, and then from there, they produce scores that allow the patients to express themselves, tell what their experience is like, and then they actually get opportunities to make improvements to the hospital as that information rolls in. Next, I wanted to talk a little bit about insurance fraud. This is becoming a huge deal, especially under the Trump administration. Health insurance fraud ensures that healthcare costs are the same for patients, their employees, and any other program that is inside of the United States. We look for things like false billing, unnecessary services, kickback, as well as any identity issues. Our goal is to make sure that we don't weaken the trust of the American healthcare system, as well as it's important for us to set up oversight. We use technology, ticketing systems like this infographic suggests to monitor these things and to make sure that we're reporting these things to enforcement officers as needed. And then next, we make sure that we have a clean line for training our staff as well as educating our patients on the importance of awareness. Prescription drug costs is one of the final things that we like to focus on in terms of healthcare governance. One of the issues is that we want to make sure that we have moderately priced drugs, especially for those things that are higher cost, like your GLP-1s. We do this by things such as looking at rebates, as well as making sure that we have 340B programs that are set up, which are safety nets for providers that service patients that are low income, as well as monitoring and reforming pharmacy benefit managers, which are basically the way that health insurance companies can purchase drugs and then resell them to their patients. One thing that's really important to know about the implementing about health policy is making sure that we have a strategy for implementation. It's important to recognize first and foremost that we have to set goals for implementing these policies and turning them into things that people can actually use. This really starts at the top by engaging leadership, providers, and staff to make sure that these we set these actual execution strategies, as well as developing workflows, staffing models, as well as budgets to make sure that we can contain whatever new policies we're starting to implement. Next, it's important to consider the fact that we need data, technology, and reporting schemas in order to make sure that all of these things can be monitored. Next, it's important to consider the fact that we have to start pilot projects, define models, as well as looking at ways to scale policies as we're taking them into the phase of implementation to ensure that number one, they're executed correctly, that the staff, the employees, and nurses all are aligned with what's going to happen next, to make sure that our technology is aligned with these workflows, and to ensure that patients get the best results out of these new policies. So, once again, to reiterate, it's one thing to have a healthcare policy developed. It's another thing for organizations to take these policies and to construct them into functional workflows that they can actually use. Now, I wanted to open this up to discussion points to make sure that we're having a perfect alignment between how things implement in Saudi Arabia versus how things are implemented inside of the United States. So the first discussion question, and feel free to either drop these in the chat or to come off mute, raise your hand, and share any of these with our with the rest of the team. So the first one is, what are the key components of healthcare governance in Saudi Arabia? So when asking this question, think about what organizations control healthcare governance. How do organizations take healthcare policies and turn them into implementation? And is this something that's actually a strong adaptation in Saudi Arabia? So I'll pause for a moment. Feel free to toss your responses in the chat, as well as any other questions that you may have related to healthcare governance. Okay, hearing no comments yet, I will go on to the next one, which is the next question is, what challenges currently exist in healthcare governance or implementation within Saudi Arabia? So feel free to come off mute if there's any questions you have about, if you have any comments about challenges that currently exist in Saudi Arabia regards to healthcare governance. Hearing none, we actually have a poll for you to take. Oh, we have a hand up. Manira, you can go ahead
Yeah,
and
yeah. Thank you so much, Robert, for very nice, very simple presentation for our students. I think I just want to say for the students, and they can participate, and there is no right or wrong answer. We can also, me and Prof. Bender, we can correct. For the first question, I want to go back to the first question.
okay. One
I
second.
think the students they can participate in this part. The key components of health governance in Saudi Arabia. I mean, you can write in the chat. It's going to be easy to read your answers.
Yes, feel free to write in the chat. We just and the importance of these discussion points, especially as students, is that it's really helpful to know from your perspective, where do we sit in terms of healthcare governance in Saudi Arabia? It's important because you are entering, especially as individuals that are in allied health and pharmacy, to prepare yourselves to mold your careers and pathways into very specific areas where you may actually have a career that most morphs out of it. So I see Maram put patient safety. That is a really important point. Any other thoughts?
Maybe patient experience also we have at the Ministry of Health.
Nice. What I'm going to do to get everybody kind of moving is that I'm going to open up our first poll of the day. And this is a way to get everybody kind of expressing themselves within a different way. So your individual answers will not be shared. It's simply going to be a way that we can interact with each other. So I'm going to start with the first poll, and it launches now. So the poll question simply is, what entity should lead implementation for health policy? Should it be government, private sector, nonprofit organizations, or some type of government partnership? And just go ahead and click your answers. I'll give you a couple minutes. And once again, your answers are not coded individually, so no one will be able to see your answers. It's just to show it as a group. Okay, so based on the results from this first poll, the majority of people actually feel that the government should be the entities that is responsible for health policy. In the United States, that is true. However, when we start to break down the go from the implementation of the health policies, a lot of non-government organizations like the NCQA and the Institutes of Healthcare Improvement play a huge role on the training, the education, and the development of workflows that enable organizations to be strong in terms of implementation. Also, private sector plays a role as well. My company, Nautical Health, is one of those organizations that go inside of hospitals, primary care groups. We work with nurses, with the C-suite, as well as physicians, and literally design their workflows, help them understand how to document these new workflows inside of the electronic medical records. And then we use reporting to actually show what improvements was made over patient experience or patient health outcomes as a result. So we will now go to the next poll, which is, in your own opinion, so this is not a right or wrong answer, What is the highest priority area for health implementation in Saudi Arabia? Is it primary care, technology adoption, workforce training, population health, and then other is an option for anything else. So go ahead, the poll is now open and select the one that you believe is the most important. Okay, and if we look at our results, the majority of participants said that primary care is actually the highest priority. Okay, so next I wanted to talk about some of the key takeaways that's really important for the Saudi Arabia, as well as the MENA community as a whole, can really take from the United States. The first one is to make sure that you're strengthening primary care. I know that in certain parts of the MENA region, there's a huge emphasis on large hospitals. And although that's great, it's really important to make sure that you're also strengthening the infrastructure of primary care groups, especially if you're entering value-based care or if you have any goals to reduce healthcare costs. Funding primary care clinics are a lot cheaper than funding major hospitals, especially when patients are basically being admitted into an ER to get basic services. Next is making sure that you engage individuals on all levels, and that's from the top in government all the way down to nurses and skilled clinical individuals at the bottom of the scale. Next, make sure that you're taking the opportunity to launch pilot projects as well as to create actionable policies, which is not just huge policies about what you can and cannot do, but making sure that you're taking the time to do policies in a way that's really important for implementation purposes. And then finally, making sure that you actually emphasize the implementation. What most countries get wrong is that we write these huge policies, but the primary care doctor, the C-suite individuals of a healthcare group oftentimes have challenges in making sure that those policies translate to how they can actually be successful, make money, and effectively support their patients. So, because there's a lot of students, one of the things that I wanted to do on this discussion today is to talk about career pathways, particularly those that are related to healthcare governance. So, I know that there are students on the line that are pharmacy majors, some are allied health, there may even be some medical students. Here's some great jobs that have huge outlooks across the world related to the implementation of healthcare policy and turning it into actionable workflows. So the first one is implementation consultants. As you may or may not already know, organizations like Deloitte and McKinsey and PwC, they're always looking for talent that's going to help translate large government bills into actual implementation processes. And that includes my organization as well. Next is data analyst. Believe it or not, even if you are a pharmacist, having a person that can understand pharmacy data and relate that pharmacy data specifically to workflows and skill sets and how it aligns to healthcare policy is becoming really niche and a high salary job throughout the United States, in the MENA region, as well as in Europe. Next is what we call translational researchers. These are the researchers that actually look at how well policy translate to actual outcomes. This is one of the perfect opportunities for individuals in the academic world to work and partner with the private sector as well as large public hospitals by collecting that data, doing pilot projects, and really seeing where the health outcomes as well as how well these particular things adopt. And then finally, patient navigators. Patient navigators are the roles where individuals are hired to educate patients on various things. So even in pharmacy, there's a need for pharmacists that are not necessarily dispensing drugs, but to actually do home-based phone calls and visits to make sure that patients are taking their drugs and medications effectively. Another use is particularly for pharmacists in the patient navigation world is that there's new pilots that are being done in the United States and the MENA region where pharmacists are being used for health education as well as rerouting patients that are filling their drugs to a primary care doctor or in some circumstances to the emergency room if they're having health issues that really require major intervention. So, some practical steps to close out with. Number one is to make sure that you have opportunities to host think tanks and focus groups around primary care physicians. Number two is that you form committees that can help move policy to implementation. Three is to emphasize technology as it integrates and shares data. And then finally, to pilot new programs and workflows that align with policies. Are there any questions? I see that there's one in the chat, but feel free to drop any other questions in the chat as in doing this section. The first question is, how important is it to launch a pilot project before implementing a full-scale health policy, and what is the optimal duration to effectively evaluate its outcomes? That is a really good question. I'm going to answer this two different ways. In the United States government, under CMS as well as HRSA, they provide grant money to government agencies, community health organizations, as well as hospitals that will do these type of pilot projects, and then that data is given back to the federal government, and that's used to inform policies. These general pilot projects run 1 to 2 years before it is complete and the government uses it for either implementation standards or to revise policy. So that's one generic answer. The next answer to it, which is very important, especially as new students and new minds that's going to help to shape healthcare in the future, it's important to engage pilot projects even before they become policy. So, in other words, if you're a hospital or you are a university and you have a pilot project that's done, it's important to take that information and send it to your legislators and send it to the ministries of health to let them see what important work that you're doing to help to influence these policies on the back end instead of waiting for the government to come up with a particular policy. Banda writes, to what extent does the interaction between public programs like Medicare and Medicaid and private sector affect access to equity in care in the United States? What lessons can Saudi Arabia draw from this? The first thing that I want to say in regards to this is that in the United States, Medicare, which is for care for the elderly, and Medicaid, which is care for the poor, are two safety nets that are utilized in order to make sure that people have access to quality health care. By making sure that healthcare, that individuals have access to quality health care, it that alone is a strategy that the United States uses to improve access as well as to address equity. Now, next point in this is how does it apply to Saudi Arabia and what lessons have we really learned over the years? The first one being just merely having access to health care does not mean that health equity is going to be addressed or that patient outcomes are going to be improved. So that means that for our colleagues in Saudi Arabia throughout the GCC region, that putting an emphasis on making sure that implementation of policies are done correctly is important, making sure that you're setting standards of care for chronic disease management, for what ranges of a particular chronic disease are should be optimal, whether that for a diabetic patient, for example, if you're setting that goal to be a hemoglobin A1C of 8 for all patients, and then making sure that you're taking steps to allow patients to comply with that, that's important. And then finally, making sure that patients are using these services effectively. So there's a difference between a Medicaid patient that's going to an ER and a Medicaid patient that's regularly going to see their primary care physician. So Sarah writes, is there going to be an attendance certificate? Yes. At the conclusion of this webinar series, every participant will receive a certificate specifically with the Nautical Health emblem on it. And then Dr. Vander, we will get with you so that we can also get the emblem for King Saud University as well.
Thank you very much, Robert, for insightful and comprehensive presentation. I would like to ask you one more question. In your view, what is the most critical reform needed in current healthcare system to effectively support Saudi Arabia evolving healthcare model and long-term sustainability?
I'll be very honest. I believe that paying attention to the current healthcare workforce is really important. I think that putting more money towards training, money towards the development of adequate workflows, as well as money towards helping individuals to use and optimize their technology is really important. We often forget that having good health care is more than just having access. It's really about making sure that the employees and the individuals that are going into the primary care centers and the hospitals every day are empowered. They understand how to do their jobs, they understand how to work with other individuals, and they understand how to use that technology. So, in my opinion, if I just had a magic wand and I was able to speak to your minister of health in Saudi Arabia, it would literally be to have conversations about what can we do to empower your workforce and how to put resources on the ground that's going to make sure that clinical employees have what they need to be successful.
Thank you.
Munir writes, how can Saudi Arabia avoid the complexity seen in healthcare system in the United States, and what governance model should be adopted to ensure efficiency, accessibility, and quality of care? Thank you so much for that question. So one of the reasons that the United States healthcare system is so complex is that the private sector has such a large stake in profits. So in the United States, there is an understanding that people implement and build healthcare centers to get rich. And so, whenever there's an emphasis on making money, the care of the patients or the emphasis on the care of the patients goes down. So, one of the things that I think that Saudi Arabia can do at the very beginning is to set caps and limits on profit margins that private industries can actually make. That way you ensure that the health and the health outcomes of patients is something that will be most important and something that you can emphasize. The second part of it is when we're talking about governance models, one of the things that I think is really brilliant is the NCQA has something called the patient-centered medical home model. And this is a model of care that has 139 different standards. And it touches everything from how to implement population health, how to implement care management, how to understand your patient level data, how to use technology. And that model has been very successful to help ensure that health policies are effectively implemented inside of hospitals as well as primary care groups. And if I had the opportunity, one of the things that I would love to do when I have the opportunity to come to Saudi Arabia and visit you all is to be able to do a crash course on the patient centered medical home. This has been very effective, so effective that many health insurance organizations require their providers to get this certificate in order to get full reimbursements for their patients. Are there any other questions? Well, thank you all so much. Just a couple things to close out. We have two more sessions. One will be on health IT, and that will be on April the 27th. And then Care Pathways, when we'll talk a little bit more about workflows, chronic disease management, things of that nature, will be on May the 4th. And then finally, if you have any questions or you want to start a project or a pilot with us, or you want to just schedule a meeting with me, you can scan either one of those QR codes, as well as you can email us at info@asknauticalhealth.com. You can visit our website at www.asknauticalhealth.com, as well as follow us on LinkedIn at Nautical Health. I'll stay on the line for a minute just in case you have any additional questions for me. But other than that, thank you so much for your time. This particular webinar will be recorded. I will make sure that the student leadership also has access to this particular presentation so that it can be distributed. And other than that, we will see you again at the end of the month on the 27th, and then we'll conclude on May the 4th.
Thank you once again, Robert, for excellent and insightful presentation. We have one last question from Noura.
Okay. Oh, I see it in the chat. No
Yeah.
problem. How can governance of healthcare face challenges in the area of digitalization as well as AI? That's a really good question. Here's one of the things that I think is really important. I'm currently managing a project for a large hospital system inside of the United States. And what my team of clinical experts are doing is actually looking at the reports for things that are developed by AI and making sure that they're actually accurate. And what we're realizing is that AI is not as accurate as we believe it to be. So, as we start to integrate more technology, we start to use AI more, it's really important to understand that you have to work alongside some group that's going to evaluate your use of technology and check to make sure that the AI is actually being implemented appropriately. That was a really, really good question. Thank you for putting that in the chat.
I think there is no more questions. So thank you, Robert, for your time and to share your experience. And we are looking forward for any other collaboration with you. I would also like to thank Professor Bander Balkhi for organizing the sessions. Finally, for all participants, thank you for engagement and contribution. We will look forward for a future discussion, inshallah.
Thank you so much. And yes, so once again, yes, we will have attendance certificates at the end of the webinar series.
Mhm.
All right. Thank you all so much.
Thank you
Thank
so
you.
much, Robert. Thank you,
Bye-bye.
Thank
everyone.
you, Robert. Thank you.
Mhm.